Hi, everyone. Thank you, Kathleen, so much for having me. Thank you to Seniors Blue Book for hosting this. I'm really excited to be here talking with you all about the first part of my new series on fall prevention. It's all about the big picture of fall prevention. So really understanding the facts, the principles, the strategies that you need in order to stop falls, increase independence, and foster a high long-term quality of life for your loved ones, for the people that you serve, and even for yourself. So we're going to get started on part one here today. I'll introduce myself in case you don't know me. My name is Emilia Bourland. I'm an occupational therapist. I also have my executive certificate in home modification from USC's Leonard Davis School of Gerontology. I have been an educator in the past at Texas Women's University, and there I taught Master of Occupational Therapy students hands-on clinical skills, as well as advanced clinical reasoning. I'm a published author and an expert in fall prevention, and I am the owner of AIPC Therapy, which is a mobile occupational therapy practice. So if you're here today, if you're watching this webinar right now, it's likely that perhaps you have experienced a fall personally, or perhaps with a patient, a client, or a loved one. Maybe you're worried about safety. You are perhaps confused or unsure about what works and what doesn't actually work in fall prevention. And there are a lot of myths out there. So I hope to dispel some of those for you during the course of this series. Maybe you've been let down by past fall prevention programs or education that you've received. Perhaps you have concerns about liabilities due to falls with clients or patients. You need evidence-based solutions. That's definitely something that's going to be provided here for you today. And above all, if you're here, I know it's because you want what is best for you. You want what's best for your loved ones, your clients, and your patients. So this training is really best for families, individuals, and professionals who value safety, families, individuals, and professionals who want to foster independence in people, families, individuals, and professionals who want comprehensive solutions for fall prevention, and families, individuals, and professionals who really want high impact strategies to use. Quickly before we get started, this is a general fall prevention series. It's not a substitute for individual programming or custom solutions for people with medical conditions or health concerns. So if you or a loved one or someone that you're working with has a medical condition, if they need customized intervention for fall prevention, then please reach out to a licensed healthcare professional such as myself or another professional and get the help that you need. So I wanted to start off with a little story about why comprehensive solutions really matter when we're talking about falls and fall prevention. So this story starts off with a woman in her 60s, really a relatively young woman. She had a pretty complex medical history though, and a complex balance disorder. She wanted more than anything to be able to take a bath sitting down in her tub. It meant a lot to her and her quality of life, but she was afraid to do it. She was afraid of falling, afraid of getting hurt. She was really feeling depressed about the situation, feeling a lot of anxiety about how dependent she was on her husband and other people to help her. And there was a lot of tension in her marriage as well. And so after an intervention that really addressed all of the factors involved in falling, so her personal characteristics, some environmental modifications and solutions, and some simple activity retraining, she was able to safely take baths without assistance. She had increased confidence, increased satisfaction with her ability to complete her self-care routine, as well as just the overall result of her self-care routine. She had an improved relationship with her spouse, and her spouse's safety also increased as a result of the modifications that we did. So let's go over real fast what kind of the essential ingredients are in fall prevention. And this is kind of going to be a good overview, a good guide for what this series is going to look like. It is a 4-part series. So the first part we're going to do today, and that's really about understanding risk and increasing the awareness of the possible consequences of falls and increasing, hopefully, the desire to act in a preventative way, in a proactive way, so that falls don't happen in the first place. The second part of the series is all going to be about the environment, friend and foe, and how changes in the environment can either dramatically increase or decrease fall risk. Part 3 in the series is all going to be about the activities that people perform and why how we do what we do matters when it comes to falls and fall prevention. And then part 4 is going to be all about the person. What are the physical characteristics, sensory and cognitive characteristics that impact fall risk? What things can we change? What can't we change? And what do we do about it? So the goals of this part of the series of fall prevention, the big picture, part 1, is that by the end of this session, I want you to name at least 2 commonly held myths about falls. I want you to understand 3 fall facts that you were previously unaware of. And I want you to be able to name at least 3 potential consequences of falling that you can use to hopefully motivate yourself or anyone else to make proactive decisions to reduce fall risk. I'm just going to warn you ahead of time that this is a really evidence-based kind of dense series. It's not, or section of the series. It's not very long, but it is a lot of evidence-based, scientific literature that we're going to go through here. Before we get to that, though, let's really define what a fall is. And it should seem obvious, but the reason I think it's important to do this is it oftentimes in many healthcare settings, we will actually define a fall by whether or not someone hits the floor, basically. If someone hits the floor in any way, shape, or form, it's considered a fall in healthcare setting. But there are other circumstances where people are falling, and we really need to capture those circumstances as well in order to be able to make sure that we're addressing fall problems before they get to the point where people are hitting the floor. So a fall is really any uncontrolled descent to any surface at all, or any attempted movement that ends up on the floor when the floor was not the goal. Sometimes the floor is the goal, but if it's not the goal and you end up there, that's a fall. So that could mean that you are falling from standing onto the bed, or a person could fall from standing into a chair, slide out of the chair onto the floor, really any of those circumstances where it's an uncontrolled descent to any surface, or a person ends up on the floor when they weren't trying to. So some myths about falls, and we're going to review these in each series as well, because I think they're important to really keep in mind to keep us proactive and keep us honest. So there are 3 that I really want to focus on here. The first one is that falls are just a part of getting old. They're inherently related to age, and that we should all expect that as we get older, it's just normal and natural to fall. That's absolutely not the case. The second one is that it's okay to fall as long as the person hasn't been getting hurt. And the third one is that the best thing to do to prevent falls is to immobilize the person. I can guarantee you 99% of the time, the right call to stop someone from falling is not to immobilize them. In fact, oftentimes that will lead to more falls, and the severity of the injuries from the falls can be much worse, actually. Sorry, I needed some tea. Okay, so why do falls happen? These are sort of all the basic reasons that falls happen, and we're going to review them throughout the series. Don't worry, we're not going to cover everything in one because it's just too much. So falls happen because of environmental hazards. They can also happen because of a poor fit between the person and their environment. Changes in activity levels that can lead to changes in the person, in their muscular strength, in their balance, in their cognition. Those can all lead to falls. Unsafe habits or practices, new or progressing medical conditions can often lead to falls. The simple belief that I won't fall, or I haven't been hurt during a fall yet, so it's not something that I need to address, is certainly something that can lead to more falls. Excuse me, I'm so sorry. Nutritional deficiencies, medication issues, and of course, proper physical support or proper equipment either not being available, being poorly understood, or not being correctly provided. So those are all the basic reasons that falls happen. So what are the facts about falls? What are the financial costs of falls? And as you can imagine, they're huge. The average cost of a hospitalization for a broken hip is a little over $15,000. the average cost of a hospitalization for an intracranial, so a brain injury, is about $18,000. And as you can imagine, for those of you who may work in healthcare, those costs can get much, much higher, much more quickly. We spend about $50 billion each year on healthcare due to falls, 50 billion with a B. And of course, there's a financial loss to healthcare institutions due to readmissions from falls. So the readmission rate for subsequent falls following admission for a fall is 17.4%. That's according to research from 2014, 17.4%. And of course, again, as you know, if you work in healthcare, if you have someone readmit to your facility, to your hospital within 30 days of a discharge, then Medicare, if Medicare is the payer, is going to take money back from you. So there's a huge financial implication for that as well. Not to mention the additional cost of rehab, both acute rehab, subacute rehab, outpatient and home health levels of rehab, and the potential to need to move into a higher level of care versus being able to stay at home. So according to seniorliving.org in 2019, the average cost of a private room in a Texas nursing home was a little over $6,500 a month, $6,540 a month. That's the average cost. Of course, we know it can go much higher. The average cost of assisted living in Texas was a little over $3,500, so $3,515 per month, plus a la carte charges for any additional services. And again, we know that it can go a lot higher than that. So really, truly, the financial impact of falls is vast. But there's more impact than just to our finances, both as individuals and as a society. There's a cost to people's independence, there's a cost to their longevity, and there's a huge cost to their quality of life. So according to the CDC, there were over 9 million fall-related injuries and over 35,000 fall-related deaths in 2016. Think about that. It's huge. 51% of people admitted to the hospital with a ground level fall ended up discharged to a skilled nursing facility, and 48% of those folks were deceased within a year after a ground level fall. Within 1 year of a broken hip, there's research showing that 50% of people have not yet returned to their prior level of functioning. And researchers also estimate that between 22 and 30% of people will pass away within 1 year of broken hip. So, I mean, again, those numbers are pretty sobering, and especially in light of the fact that many of these falls can be prevented. And so that's the lighter side of this. Let's really get into this right now. These numbers are from a systematic review from 2018 that sifted through all the evidence and really identified the top number of ways to reduce falls. The number one way to reduce falls was through occupational therapist-led home modifications. The number two way was actually through expedited cataract surgery. Number three, medication review and modification. Number four was Tai Chi for mobility problems for people who were already rated with excellent or good health. Vitamin D supplementation was a huge one. At number five. Number six, the use of single vision lenses during single-use vision lenses during outdoor activities for people who use multifocal lenses. Number seven, Tai Chi again, for people with neurological related balance issues, but don't yet have a history of falls. Number 8 and 9, both Otago programs with PT. Number 8 is for people with a history of falls, and number 9 for people with fair or poor health. A couple little other things I want to point out about the data on this slide. You'll see that number 1 and number 5 both have asterisks, as well as a couple extra numbers behind them. And those are related to the number of people the researchers estimate are at risk from falls for number 1, due to environmental hazards, and for number 2, due to decreased vitamin D levels. And those were the top 2 amongst all of these things. Those were the top 2 risk factors for falls. So again, the occupational therapy-led home modifications being very important to reduce those risks, and vitamin D supplementation being very important for folks who have low vitamin D levels. Some more systematic reviews to go over. So home modifications led to improved function, decreased fall risk, and increased ability of caregivers to provide appropriate care. Those effects are then increased when they're combined with comprehensive fall prevention programs that are led by skilled service providers, such as occupational therapists. Occupational therapy-led interventions lead to a significantly higher rate of recommendation adherence versus non-professional and other healthcare provider recommendations. And comprehensive occupational therapy fall prevention interventions lead to decreased fear of falling, reduced number of falls, and increased independence. So lots of research there. Really what this comes down to is comprehensive programs really need to include addressing all of the issues that go on in falls. And that includes the environmental factors that are involved, the activity, performance, and habits and routines that are involved, and the client factors that are involved, including their physical, sensory, cognitive, emotional, and psychosocial aspects of their character and their situation. And that's why there's so much evidence demonstrating that occupational therapists are so effective, is because we are professionals who actually address all of those things together. So to review and wrap up for this session here today, the cost of falls has a really significant impact on people and our society, both in terms of the finances of people and our society, and in terms of quality of life. The great thing is that there are many things that can actually be done as part of a comprehensive fall prevention program to reduce those falls, to reduce the financial cost and the quality of life costs. And when fall prevention programs are implemented by the right highly skilled and highly trained professionals, you're going to reduce falls. You're going to reduce debility and disability. You're going to reduce the demands on caregivers, lower healthcare costs, increase participation, increase independence, and of course, get to the final goal, which is ultimately to increase everyone's quality of life. So as you can see already, this is kind of a complex issue. Comprehensive fall prevention is not a simple thing to do. So if you need fall prevention solutions, customized training, individual training, or staff training, then please don't hesitate to reach out. You can call me there at my number that you see, or email me at my email address. Request a free consultation, have the opportunity to get the recommendations that you absolutely need for best solutions and the best options for you in your situation. If you just want access to more free information, more free tips, then please visit my website at www.aipctherapy.com /fall-prevention, and you can sign up for my fall prevention and independence newsletter. It's full of helpful tips and tricks all about being independent and reducing fall risk at home. And of course, I want you to make sure that you are watching Fall Prevention, the big picture, parts 2, 3, and 4, where we're going to go over how the environment can be modified. We're going to go over how activities matter when it comes to falls and fall prevention, and of course, how we can address the characteristics of the person to prevent people from falling as well. So coming soon, up next is going to be part 2. That's environment, friend, and foe. How changes in the environment can dramatically increase or decrease fall risk almost instantly. And it really can be that quick sometimes. If you have any questions or concerns, comments, please call me, Emilia, at 469-998-1245, or send me an email anytime. I would love to talk to you. I would love to hear your story, hear what's going on, and help you in any way that I can. Special thanks to Kathleen Warshawsky and Seniors Blue Book for hosting this, for giving me the platform in order to provide this information that people need so much. Thank you. I know that the community appreciates it too. Here's the reference list for today. Of course, if you got the slide, you can look up any of those references that you'd like to. And again, if you have any questions or concerns, if you need individual solutions, custom solutions, staff training, etc., please don't hesitate to reach out. You can call or email, get your free consultation, and get the recommendations that you absolutely need for the best solutions for you and your people, the people that you care for, and find out what your best options are. If you want more free tips, please visit my website, for fall prevention and sign up for the free fall prevention newsletter. I would love to send it to you. And then, of course, watch fall prevention parts 2, 3, and 4 coming up. It was so great to be here today. Thank you so much again for having me, and I look forward to sharing the next parts of the series with you. Bye.
Thanks, Emilia.